I want you to do something right now. Lie down on your back if you are able, or sit back in your chair and relax your abdomen completely. Place 2 fingers flat against the center line of your belly, right at your navel. Now gently press down and lift your head slightly as if you are beginning a sit-up. Do you feel a gap? A soft depression? A valley running vertically down the center of your abdomen where your fingers sink in rather than meeting firm muscle resistance? If you felt that gap, I need you to hear what I am about to say very carefully. That gap is not loose skin. It is not simply belly fat. It is not a consequence of poor fitness or lack of willpower. It is a structural separation of the 2 halves of your abdominal wall, a condition called diastasis recti, and it is one of the most misunderstood, most mismanaged, and most consequentially ignored abdominal conditions affecting adults over 55, particularly women who have had children, but also men and women who have never been pregnant and would never suspect this diagnosis applies to them. Here is what makes this conversation urgent. The exercises most people instinctively reach for when they notice abdominal weakness or a protruding belly, sit-ups, crunches, leg raises, planks performed incorrectly, bicycle crunches, are not just ineffective for diastasis recti, they actively make it worse. Every single repetition of those movements increases the intra-abdominal pressure that drives the 2 separated halves of your abdominal wall further apart. Every crunch you have ever done, believing you were strengthening your core, may have been widening the very gap you were trying to close. And the physical consequences of that widening gap extend far beyond appearance. Chronic lower back pain that does not respond to standard treatment. Pelvic floor dysfunction, including urinary incontinence that most people attribute entirely to aging. Poor posture and spinal instability. A persistent feeling of abdominal weakness and lack of core support that makes daily movements, lifting groceries, getting up from the floor, carrying anything heavier than a handbag, feel effortful and uncertain in a way they did not used to feel. These are not small inconveniences. They are daily limitations that steal quality and confidence from your life. And most people living with them have never been told they have diastasis recti, never been told the exercises they are doing are making it worse, and never been told that one specific category of exercise, approached in one specific way, can begin to heal the separation and restore the functional abdominal strength they have been missing. Today I am going to tell you all of that, and I am going to give you the complete protocol. My name is Dr. Michael Ellis. I am 85 years old. I have spent my entire career in preventive medicine, working with older adults on core stability, spinal health, and functional movement. And diastasis recti in adults over 55 is one of the most consistently underdiagnosed and most dramatically mismanaged conditions I have encountered across 6 decades of practice. The conversation this community needs to have about this condition is long overdue, and today we are having it. Before we go any further, drop a comment below right now. Have you ever been told you have diastasis recti? Or did you just perform that finger test for the first time and find something you were not expecting? Write your answer in the comments. I read every single one personally, and what this community shares here shapes every video I make. Now let us begin with the anatomy, because understanding exactly what diastasis recti is at the structural level is the foundation of understanding why only one specific category of exercise heals it, and why every other approach makes it worse. What diastasis recti actually is, the anatomy nobody explains. Your abdominal wall is not a single flat sheet of muscle. It is a complex, layered structure of 4 distinct muscle groups working together to provide spinal support, control intra-abdominal pressure, maintain posture, and generate the force needed for virtually every physical movement your body performs. The outermost and most visible layer consists of the rectus abdominis muscles. These are the paired vertical columns of muscle running down either side of the center line of your abdomen, the muscles that form the visible six-pack in lean individuals. These 2 columns are not a single continuous muscle. They are 2 separate muscles joined at the center by a band of connective tissue called the linea alba. The linea alba runs from your breastbone to your pubic bone, and it is the structural anchor point that holds the two sides of your abdominal wall together. In a healthy abdominal wall, the linea alba is narrow, dense, and taut. It holds the two rectus abdominis columns close together and transmits force efficiently between the left and right sides of the core. When you lift something, cough, sneeze, or change position, the linea alba distributes load across the entire abdominal wall, allowing it to function as a unified structure. Diastasis recti occurs when the linea alba is stretched, thinned, and widened beyond its functional threshold. The two rectus abdominis columns separate. The connective tissue between them becomes slack, thin, and mechanically insufficient. The gap that results, which can range from 2 centimeters to 6 centimeters or more in severe cases, means the abdominal wall can no longer function as a unified structure. It cannot generate or transfer force efficiently. It cannot adequately support the spine. It cannot manage intra-abdominal pressure effectively. And here is the detail that explains why so many people over 55 have this condition without knowing it. Diastasis recti is caused by sustained elevated intra-abdominal pressure, stretching the linea alba beyond its elastic capacity. Pregnancy is the most well-known cause because the growing uterus creates prolonged, massive intra-abdominal pressure over months. But pregnancy is far from the only cause. Chronic obesity creates sustained elevated intra-abdominal pressure over years. Repeated abdominal straining, including chronic constipation, creates spikes of extreme intra-abdominal pressure. Incorrect breathing patterns that chronically load the abdominal wall create sustained pressure. And paradoxically, conventional core exercises performed incorrectly, including crunches, sit-ups, and certain yoga movements, create spikes of intra-abdominal pressure that stretch the linea alba with every repetition. The result is that a significant proportion of adults over 55 have some degree of linea alba separation, regardless of whether they have ever been pregnant, regardless of whether they are significantly overweight, and regardless of whether they have ever been diagnosed with any abdominal condition. Research published in the Journal of Orthopedic and Sports Physical Therapy found that diastasis recti is present in approximately 39% of women over 45. Studies examining men with chronic lower back pain have found diastasis recti present in rates significantly higher than the general population. It is not a rare postpartum condition. It is a common structural reality of the aging abdominal wall that most people over 55 have never had examined. Why every exercise you have tried has failed or made it worse. Before I tell you what works, I need to tell you specifically and clearly what does not work. Because the exercises most commonly prescribed for abdominal weakness and core strengthening are precisely the exercises most likely to worsen diastasis recti. And understanding why is what will prevent you from making that mistake again. Crunches and sit-ups. When you perform a crunch or a sit-up, the rectus abdominis muscles on both sides contract powerfully in an attempt to flex the spine forward. But because the linea alba connecting them is slack and insufficient, the force those contracting muscles generate does not translate into effective spinal flexion. Instead, it generates a spike of intra-abdominal pressure that pushes outward against the already weakened center line. The separated halves of the abdominal wall are pulled further apart rather than drawn together. With every repetition, the linea alba is stretched further. With every repetition, the gap widens rather than closes. This is why so many people with diastasis recti notice that their belly appears to cone or dome outward at the center line during crunch movements. That doming is the contents of the abdomen being pushed outward through the insufficient linea alba. It is visible evidence that the exercise is making the separation worse in real time. Leg raises, supine. Leg raises, lifting both legs simultaneously while lying on your back, create some of the highest intra-abdominal pressure spikes of any common exercise. The hip flexors that drive the movement pull on the lumbar spine, creating a massive internal pressure demand that the weakened linea alba cannot adequately contain. For someone with diastasis recti, this exercise is among the most damaging movements they can perform. Conventional planks. A plank performed without specific attention to managing intra-abdominal pressure and without adequate deep core activation actually loads the weakened linea alba significantly. The weight of the trunk hanging between the hands and feet creates a gravitational load that the insufficient center line must resist. Without proper deep core engagement first, this gravitational loading widens the gap rather than supporting closure. Oblique exercises including bicycle crunches and Russian twists. These rotational movements generate particularly damaging forces on the linea alba because rotation combined with flexion creates a twisting tension across the center line that pulls the separated halves in opposing directions simultaneously. If you have been performing any of these exercises in the belief that you were strengthening your core and have noticed no improvement or a worsening of your abdominal appearance and back pain symptoms, this is the explanation. You have been working against your own anatomy rather than with it. Type the word gap in the comments if this explains something you have been experiencing and wondering about, because understanding why previous efforts failed is as important as knowing what will work. The only exercise category that heals diastasis, deep core activation. Here is the answer that the title of this video promised you. And I want to be precise about what it means because the word exercise in this context does not mean what most people assume it means. The only exercise approach that heals diastasis recti works by targeting the deepest layer of the abdominal wall. Not the rectus abdominis, the outermost muscles that crunches target, not the obliques, the deepest layer, the transverse abdominis. The transverse abdominis is a horizontal band of muscle wrapping completely around the abdominal contents like a corset. It is the deepest of the 4 abdominal muscle layers. And unlike the rectus abdominis, which generates flexion force that increases intra-abdominal pressure, the transverse abdominis, when properly activated, performs a compression function. It draws the abdominal wall inward and narrows the waist without increasing intra-abdominal pressure. In fact, it reduces intra-abdominal pressure while simultaneously increasing tension and stability in the linea alba. This distinction is everything for diastasis recti. The transverse abdominis is the one abdominal muscle whose activation draws the 2 separated halves of the abdominal wall toward each other rather than pushing them apart. When you activate the transverse abdominis correctly, you are applying a gentle, constant compression force across the linea alba that over weeks and months of consistent practice stimulates the connective tissue to remodel, thicken, and regain functional tension. Research published in Physical Therapy Journal found that targeted transverse abdominis training produced measurable reduction in interrecti distance, the clinical measurement of diastasis gap width, over an 8-week program in postpartum women. Subsequent research has confirmed similar results in older adult populations without recent pregnancy history. The linea alba is connective tissue. Connective tissue remodels in response to mechanical load. The correct mechanical load, the gentle, consistent compression provided by transverse abdominis activation, stimulates the collagen fibers of the linea alba to reorganize and strengthen. This is not a rapid process. It requires consistency over weeks and months, but it is a real biological process with documented outcomes. Now let me give you the complete protocol, starting from the most foundational element and building progressively through 5 stages toward functional strength. Stage 1. Finding and activating the transverse abdominis. This is where every person with diastasis recti must begin, regardless of their current fitness level. Because the transverse abdominis is a deep postural muscle that most people have no conscious awareness of or voluntary control over. You cannot strengthen a muscle you cannot find and activate deliberately. Sit comfortably in a chair or lie on your back with your knees bent and feet flat. Place both hands on your lower abdomen, just inside your hip bones. These are the 2 points where you will feel transverse abdominis activation when it occurs correctly. Now breathe in gently through your nose, allowing your belly to expand naturally. Do not force the expansion, just allow it. Then breathe out slowly through your mouth. At the very end of your exhale, when you have released all the breath you comfortably can, gently draw your lower abdomen inward and upward. Not a dramatic sucking in, not holding your breath. A gentle narrowing of the lower belly, moving inward approximately 20 to 30% of its full range. You should feel a gentle tension develop beneath your fingertips. Hold that gentle inward activation for 5 seconds while continuing to breathe normally and shallowly. This is critical. You must be able to breathe while maintaining the activation. If you cannot breathe while holding the activation, you are working too hard. Reduce the intensity of the contraction by half. The transverse abdominis is a postural muscle designed to work at low intensity for sustained periods. You are training endurance and control, not maximum force. Release completely. Rest for 5 seconds. Repeat. Perform 10 repetitions of this 5-second hold. Practice 3 times daily, morning, midday, and evening. This frequency matters because you are training a motor pattern, a new neural pathway between your brain and a muscle that has been effectively switched off. Neural pathway development requires repetition across multiple sessions per day in the early weeks of training. This foundational activation exercise is the single most important thing in this entire protocol. Do not skip ahead to the more advanced exercises until you can perform this activation consistently, automatically, and while breathing normally. This typically takes 1 to 2 weeks of 3 times daily practice. Stage 2. Dead bug with transverse abdominis pre-activation. Once you can reliably activate the transverse abdominis, the dead bug exercise is the first movement that safely loads the core while maintaining that deep activation throughout. Lie on your back with your knees bent at 90 degrees directly above your hips and your arms extended straight up toward the ceiling. This is the starting position. Before you move anything, activate your transverse abdominis using the technique from stage 1. Gently draw the lower abdomen inward and hold that activation throughout the entire exercise. While maintaining the transverse abdominis activation and keeping your lower back in contact with the floor, slowly lower your right arm overhead toward the floor and simultaneously extend your left leg toward the floor. Move slowly. The descent should take 4 full seconds. Do not allow your lower back to arch away from the floor at any point. If your back begins to arch, stop the movement where you are and return to the starting position. That is your current range of motion. Work within it. Return your arm and leg to the starting position, taking 4 seconds. Switch sides. Left arm overhead and right leg extending simultaneously. That is 1 complete repetition. Perform 5 repetitions on each side initially. The primary focus is maintaining the transverse abdominis activation and the lower back contact throughout every second of the movement. Not the range of motion, not the number of repetitions. The quality of the deep core engagement is everything. Perform 2 sets with a 90-second rest between sets, 3 times per week. As you master the pattern, increase to 10 repetitions per side over the following 4 to 6 weeks. The dead bug is the exercise most consistently recommended by physical therapists specializing in diastasis recti rehabilitation because it loads the core through limb movement without generating the intra-abdominal pressure spikes of conventional core exercises. The transverse abdominis must work to stabilize the spine as the limbs move, but it does so through its compression mechanism rather than its pressure mechanism. Stage 3. Heel slides with transverse abdominis activation. This is a gentler progression than the dead bug for those who find the limb coordination challenging or who have significant lower back sensitivity. Lie on your back with both knees bent and feet flat on the floor. Activate your transverse abdominis. While maintaining the activation, slowly slide your right heel along the floor, extending your right leg until it is straight, or as close to straight as you can manage without your lower back arching. Slide it back to the starting position. Repeat on the left side. The movement itself is minimal. The challenge is maintaining the transverse abdominis activation and the spinal position throughout. Perform 10 repetitions on each side, 2 sets, 3 times per week. Heel slides can be practiced as a warm-up before the dead bug exercise, preparing the neural pathway for transverse abdominis activation before introducing the more complex coordination demands of the full dead bug pattern. Stage 4. Standing transverse abdominis with functional movement. This stage transitions the deep core activation from the controlled floor environment to standing upright movement, which is where your abdominal wall actually needs to function in daily life. Stand with feet hip-width apart. Activate your transverse abdominis. Hold the activation at 30% intensity, not gripping, not bracing, but gently engaged. Now practice walking 10 steps while maintaining the activation. Stop. Check whether you are still engaged. Walk 10 more steps. This stage is less about exercise and more about reprogramming movement. The goal is to integrate transverse abdominis activation into your automatic postural habits. Standing, walking, reaching, lifting. All of these daily movements are currently performed without deep core engagement in most people with diastasis recti. Building the neural habit of gentle, ongoing transverse abdominis activation during daily movement is one of the most powerful long-term therapeutic interventions available for this condition. Practice walking with activation for 5 minutes twice daily. Additionally, begin applying transverse abdominis pre-activation before any lifting movement, no matter how light. Before you lift a grocery bag, activate the transverse abdominis. Before you pick up a grandchild, activate the transverse abdominis. Before you push a heavy door, activate the transverse abdominis. This pre-activation protects the linea alba from the intra-abdominal pressure spike that lifting without deep core engagement creates. Type the number 4 in the comments if you are ready to make this daily habit a permanent part of how you move through your life. Because this stage, more than any single exercise, is what produces lasting functional improvement in diastasis recti over time. Stage 5. Supported bridge with transverse abdominis activation. This final stage introduces a gentle posterior chain strengthening element that is specifically beneficial for diastasis recti because weak gluteal and hamstring muscles force the lower back to compensate, chronically loading the abdominal wall in ways that maintain the separation. Lie on your back with knees bent and feet flat on the floor, hip-width apart. Activate your transverse abdominis. Keeping the activation, gently press your feet into the floor and lift your hips slowly off the floor until your body forms a straight line from your knees to your shoulders. Hold for 3 seconds at the top. Lower slowly over 4 seconds. The critical instruction here is to avoid gripping the gluteal muscles maximally. You are looking for a moderate gluteal contraction that lifts the hips without creating the abdominal bracing pattern that increases intra-abdominal pressure. The transverse abdominis activation should remain the primary engagement throughout. Perform 10 repetitions, 2 sets, 3 times per week. This exercise can be performed on the same days as the dead bug exercise as part of a complete session. The breathing pattern that is secretly worsening your diastasis every day. There is one element of diastasis recti management that no exercise program can compensate for if it is not addressed simultaneously: your breathing pattern. Most adults over 55 have developed what physiotherapists call an apical breathing pattern, breathing primarily into the upper chest, with the shoulders rising on inhalation and the abdomen remaining relatively still. This breathing pattern chronically underuses the diaphragm and creates a compensatory pattern where the abdominal wall substitutes for the diaphragm in managing breath pressure. Every breath taken in an apical pattern creates a small but repeated intra-abdominal pressure pulse. Multiplied across 20,000 breaths per day, that is 20,000 daily microstresses to the linea alba that accumulate silently over years to maintain and worsen the separation, regardless of what you do in your exercise sessions. The therapeutic breathing pattern for diastasis recti is 360-degree diaphragmatic breathing. On inhalation, the belly expands gently outward and slightly to the sides. The rib cage expands three-dimensionally, rather than the chest lifting upward. On exhalation, the belly gently returns inward, and the transverse abdominis naturally engages. This pattern works with the deep core rather than against it. Practice this breathing pattern consciously for 5 minutes each morning, lying on your back with knees bent. Place one hand on your chest and one hand on your belly. Breathe so that the belly hand rises on inhalation and the chest hand stays still. This is the corrective breathing practice that addresses the hidden daily stressor that no exercise session can overcome if the breathing pattern is not also corrected. What to avoid permanently. Now that you understand both the anatomy and the correct therapeutic approach, I want to give you a permanent list of movements and habits to avoid that will undo whatever progress your deep core training produces. Never perform crunches or sit-ups in any form. Not decline crunches, not oblique crunches, not machine-assisted crunches. No form of spinal flexion against resistance is appropriate for diastasis recti at any stage of recovery. Never perform double leg raises. Single leg movements performed with transverse abdominis pre-activation and careful spinal position management are safe and eventually beneficial. Both legs simultaneously is not. Never hold your breath during exertion. Breath holding during lifting creates a Valsalva maneuver, an extreme spike of intra-abdominal pressure that is one of the most damaging things you can do to an insufficient linea alba. Exhale on the exertion phase of any movement always. Never skip the transverse abdominis pre-activation before lifting, no matter how light the object. The habit of pre-activating before load is what protects the linea alba in daily life between exercise sessions. And never gauge your progress by appearance alone in the early weeks. The linea alba remodeling process occurs at the connective tissue level and produces functional improvements in back pain, core stability, and pressure management that precede visible changes in abdominal appearance by weeks. Trust the process and measure your progress by how your back feels, how stable your core feels during daily movement, and by reassessing the finger gap test monthly. When to see a specialist. The protocol I have given you today is appropriate for mild to moderate diastasis recti in adults who have no other active abdominal or pelvic floor conditions. However, there are specific situations that require professional evaluation before beginning any exercise program. If your gap measured more than 4 finger widths in the self-assessment at the beginning of this video, please see a pelvic floor physical therapist before proceeding independently. A gap of this magnitude may require manual therapy and individualized assessment before self-directed exercise is appropriate. If you experience any pain in your lower abdomen, pelvic region, or lower back during any of the exercises described today, stop immediately and seek professional evaluation. Pain during these gentle exercises indicates something that requires individual assessment. If you have any history of abdominal hernia, abdominal surgery, or pelvic organ prolapse, please consult your physician before beginning this program. These conditions can coexist with diastasis recti and require a modified approach that accounts for all conditions simultaneously. A pelvic floor physical therapist is the ideal specialist for diastasis recti management. They can assess the severity of your separation, evaluate your pelvic floor function, which is intimately connected to abdominal wall integrity, and provide manual therapy and individualized exercise prescription that goes significantly beyond what a general video can offer. Ask your primary care physician for a referral if you have any of the complicating factors above. At 85 years old, I have watched this condition silently limit the daily lives of thousands of older adults who were never told what was happening to their abdominal wall and never given an alternative to the exercises that were making it worse. The back pain that seemed to have no source, the core weakness that made every physical task feel effortful, the abdominal appearance that no amount of conventional exercise seemed to change, the leaking and pelvic instability that was quietly accepted as inevitable aging. All of it traceable in many cases to a structural separation of the abdominal wall that was both underdiagnosed and systematically worsened by conventional fitness advice. The transverse abdominis is the answer, not because it is a miracle muscle, but because it is the one muscle whose activation mechanism draws the separated halves of the abdominal wall together rather than driving them further apart. 5 stages. Foundational activation, dead bug, heel slides, standing integration, supported bridge, a corrected breathing pattern practiced daily, and a permanent commitment to avoiding the movements that undo the progress. This is not a quick fix. Connective tissue remodeling takes time. 3 months of consistent practice produces different tissue than 3 weeks. 6 months produces different tissue than 3 months. The biology works on its own schedule, and that schedule rewards patience and consistency rather than intensity and urgency. Begin with stage 1 today. Practice 3 times. Find your transverse abdominis. Learn its activation. Build that neural connection. Everything else in this protocol becomes possible once that foundation is in place. If this video gave you something genuinely important today, please subscribe. Every single week, I bring you honest, research-based, practical health information designed specifically for adults over 60 who deserve accurate answers rather than generic advice that was never designed for their bodies. And leave a comment below. Did the finger test at the beginning of this video reveal something you were not expecting? How long have you been dealing with back pain or abdominal weakness that you now wonder might be connected to diastasis recti? I read every single comment personally. This conversation matters, and so does your experience. Take care of yourselves. I will see you in the next one.